I mentioned the problem with obtaining human islets, and so we are establishing a network and technology for isolation of human islet cells from different types of pancreatic specimens to do several studies on the beta cell biology, which I think this is a very important aspect of this general project. One of the outcomes also would be unraveling the key pathway and site that control GLP-1 trophic action on beta cells. You know that GLP-1 is the latest addition to the drugs that can be used to treat type 2 diabetes. This is a very efficient drug which works mostly on beta cells and which can control beta cell mass, function, and proliferation. And there's so far little known about the mechanism how this works on the at the beta cell level, but if we can identify this mechanism, so maybe we can have some alternate paths to treat beta cell deregulation. New and unique imaging technology. This is, as I mentioned, something really key. And novel probes, and that is an imaging probe for earlier and better monitoring of beta cells function and mass in human. The benefit to the patient, clearly to monitor specific disease progression and enable improved disease management. There's still really a lack of capacity to follow the dysfunction of the beta cells during the pathogenesis of type 2 diabetes and also following treatment. Then to pave the way for the development of beta cell focused therapies, as mentioned before by Alain and Ktorza. So where the idea is really to be able to follow really what happens to the beta cells and cure them. So better biomarkers to monitor therapy, better disease-centric in vitro and in vivo models that can be used to test various modalities of treatment, and better understanding to enable focused therapeutic approach. Now, of course, this is one important thing is that it's an academic pharma collaboration, and so it took us quite some time actually to finalize the project and to start the project, because there was a lot of discussion to actually where we needed to get to the same level of understanding between pharma and academics to really be in the same wavelengths if you want to work together. And I think it has been long, but I think it's quite successful, and actually we are starting now to have to work in a very good spirit, where all the work package that I mentioned before are co-led by an academic work package leader and a pharma academic work package leader also. So everything is done together actually for all the development, the fixing of the objectives, and the finding of the means to develop the different projects. So this has been working pretty well for going through for data results sharing and also for development of the different projects. We are really at the start, but I think we are on a good start. So far, this has been just 4 months, so it's short. So we have a number of tools related to the tools. So evaluation of first version of in vitro model system, for instance, the human beta cells, data acquisition process for systems biology. So there's a really huge infrastructure which has been put in place to accept and study and work with the different data that will be generated. And for the biorepository, for human tissue and also patient material, this has been done. So we have also started to do the first synthesis of imaging molecule. For the biomarker, we are starting to do human assessment study in preparation. So this is really ongoing and starting, I think, on a good foot. So for the time and money, so you know that that's a 5-year project. We just started, and this is the money from the EU, the in-kind contribution, and the total cost of the project. So this is just briefly the different partners which are located in the different region of Europe, which are indicated here. So I do not list these things because you probably have also the information, but also we now have the website which has been made public this morning at 8:20 or something like that. And also related to that, we have a press release which has just been issued this morning about the description of the work and the launching of this IMIDIA project. So this is now public, and so you can get, this is the IMIDIA website, imidia.org, where you can find all the information, and possibly also this presentation will be uploaded, if I'm correct, on this site. And of course, this is for the IMIDIA and IMI Europa. Okay, that's all what we stop here, so thank you for your attention.
Any questions? Hello, I'm from the University of Romania, and I have a question about the ethical issues. How did you sort out these ethical issues about human patients, especially for non-diabetic patients, to prelevate the beta cell tissues?
Right, I mean, it's very different, so I cannot give you all the details because there's been a lot of information, and probably Peter Hecht, who has been following that, can give you more information. But clearly, as you know, the ethical requirement may be a little bit different depending on the countries. So there has been a lot of work actually to harmonize and put in place all these ethical issues so that we can actually collect and have the human islets, either the pancreas or the islets, and stored and frozen and followed, and the information stored in this central database where there is some anonymization. Maybe Peter, can you comment a little bit more on that?
Basically, we were guided by this informed consent, the patient signed the informed consent, and also within this project we only see anonymized patient data. So in other words, the patient data is with the physician and never gets into the project. If we have certain questions from the scientific perspective, we always need to contact the physician for further information. So basically it's this twofold approach, basically for the materials, informed consent or equivalent by country. For the data, the physician holds it, and we only see a completely anonymized identifier in that project.
Can I ask you, what is your approach for system in biology in your model?
I'm sorry, I didn't get that.
You speak about system in biology.
Oh, systems biology, right.
Yeah, what is your approach for that?
Oh, right. I'm not sure if you can. What I can tell you is that, well, we are going to study the progression of type 2 diabetes in animal models, in different different type of mice, when they are fed, when they are stressed, metabolically stressed. So we are going to follow many different different parameters, using omics technology, genomics, lipidomics, morphologic techniques. No. It's a metabolic stress. It's feeding different diets that can probably induce diabetes.
Okay.
Yeah.
Okay, maybe one more question, and then we'll, if perhaps you can pursue during the break.
Ruth McNerney, London School of Hygiene. I've got a very simple logistical question as someone who's looking to put in grant to the system. You suggested there were some delays. How long has it actually taken between getting past the letter of intent to actually getting the project launched and kind of your hands on the money, roughly? So
it was probably something, I mean, from the time, because we have to start, it's a two-step process, so we have to put together an academic network and then go to the expression of interest, and the second, and then solving all the issues of the grant agreement, and until we got the starting date. So it was probably close to 2 years. Yeah.